Welcome to the new Biodex Sit2Stand Trainer presentation. This device was developed and designed with a particular goal in mind: strengthening muscles associated with rising from the seated position to maintain independence. During this short presentation, we are going to cover the following information: the importance of maintaining mobility and quality of life as one ages, the baby boomers and the effect that they will have on the healthcare system if they do not stay mobile, how the ability to rise from a chair is often the weakest link in the mobility chain, and how the Sit2Stand trainer can help. Mobility has shown to be an important factor for maintaining quality of life as people age. The CDC has stated that mobility is paramount to the health and well-being among older adults. If mobility is impaired, it leads to a variety of adverse health outcomes. Maintaining optimal mobility is fundamental to healthy aging. Once an older adult starts to have mobility impairment, illnesses follow, including muscle atrophy, depression, and cardiovascular disease, just to name a few. Health professionals play a key role in improving mobility as the population continues to age. The baby boomer generation will cause the over 65 population to double in the next 25 years. Based on this, the sheer numbers will overwhelm the current healthcare system. The goal is to keep older adults out of the disability zone for as long as possible, where they become dependent on the healthcare system and their families, often putting burden on both. Early in life, we are dependent on others to care for us. As adults, we become independent with the goal to remain independent throughout most of our life. As one ages, decreased strength and mobility limits the ability to perform activities of daily living, causing one to enter the disability zone. This depiction demonstrates how age and health status are related to independence. Maintaining or improving mobility reduces dependence, allowing one to enjoy a better quality of life and decreasing the burden on family and the healthcare system. Studies have shown that rising from a seated position is a basic function that older adults need to maintain optimal mobility. More range of motion, strength, and power is required to get out of a chair than walking or climbing stairs. Without performing some sort of exercise to keep up the strength and power necessary to get up from a chair, the sit-to-stand motion is the first link in the mobility chain to falter. If the first link is broken, the remaining mobility links suffer, causing a downward sequence of events to occur. Biodex has developed a family of balance and mobility devices to help older adults maintain their functional independence. New to this family is the Sit2Stand trainer. The new Sit2Stand trainer's main purpose is to exercise the muscles associated with the sit-to-stand motion, which is critical in keeping the mobility chain intact. The Sit2Stand helps to increase strength, power, and coordination. It can accommodate a broad range of patients, such as active older adults, those who do not wish to become dependent, and those already compromised by disease, neuromuscular disorders, or have undergone surgery. The Sit2Stand is designed with a broad range of patient population in mind. Unique features are used to address the distinct issues of the aging. For instance, our assistant selector adjusts easily and quickly, making it simple for someone to use it on their own. The range of motion stop reduces the degree of knee and hip flexion, especially important for orthopedic patients. The stabilization belt provides security and safety for those who may be less stable on their feet. The foot placement grid is used for proper foot alignment and provides the user with the ability to consistently align proper foot position. The arm handles are removable to provide open access for those patients who may need to transfer from a wheelchair. A unique feature of the Biodex Sit2Stand Trainer is the fact that it follows the patient through the complete range of motion, regardless of patient height. The seat always starts at 18 inches off the floor, which is standard chair height, no matter how tall the person is. This allows each user to go through the full range of motion and develop muscular strength throughout the complete and functional range of the sit-to-stand motion. The Sit2Stand Trainer matches the natural strength curve of the sit-to-stand motion, providing more assistance at the beginning of the standing motion, where less user strength is available, and providing less assistance at the end of the standing motion, where more strength is available. This attention to proper biomechanics allows the muscles to avoid fatigue at only one point in the range of motion, and allows strength to develop throughout the whole range of motion. Studies have shown that symmetrical contribution from both legs is important for developing neuromuscular coordination, reducing fall risk, and helping to avoid joint ailments. The Sit2Stand makes a great training device to help maintain weight-bearing symmetry for those challenged by weakness of the hip, knee, or recovering from other lower body surgeries or injuries. The Biodex Sit2Stand Trainer was created for a diverse group of users in both the physical therapy and wellness environment. In summary, the Sit2Stand increases range of motion, improves and maintains strength, power, and neuromuscular coordination. Great for teaching proper biomechanics, and reduces injury potential for therapists. Thank you for your interest in the Biodex Sit2Stand Trainer. For more information about the Sit2Stand Trainer or any of the other Biodex physical medicine devices, you can call, write, or visit our website.